Today we will discuss cystic hygroma. तो सिस्टिक हाइग्रोमा बेसिकली ये बच्चों में होता है जो कि मोस्ट कॉमनली नेक में मिलता है. इट इज़ ए कंजेनाइटल malformation, so usually present in neonates and early infancy. Occasionally it is present at the birth, and sometimes it is so much big in size that it may obstruct the labor. So common age of presentation is neonate and early infancy. Sometimes occasionally it may present at birth. Common site is in the neck. So as name suggests, it is a cystic hygroma. So this is a cystic swelling. This is a cyst filled with clear lymph. So this is a lymphatic malformation, a swelling which is cystic, lined by single layer of epithelium and filled with clear lymph, and it gives a mosaic appearance. Though it is filled with clear lymph, so it is brilliantly transilluminant on transillumination test. So this is the very important finding on transillumination test. It is brilliantly transilluminant swelling. Site, as we discussed, it is most commonly in the neck. नेक में पैरोटिड, सबमैंडिबुलर, टंग एंड फ्लोर ऑफ द माउथ एरियाज में प्रेजेंट होती है. इट मे बी बायलैटरल, मोस्टली यूनिलैटरल होती है, बट इट मे समटाइम बी बायलैटरल. एंड ऑन कंसिस्टेंसी इट इज़ सॉफ्ट इन कंसिस्टेंसी, partially compressible. On as we compress, sometimes fluid displaces and it is partially compressible. As child cough and cry, visibly swelling is increasing in size. So it is slightly increase in size as the child cry or cough. As we discussed, it is brilliantly transilluminant, which distinguishes from the other neck swellings. So this is very important. On transillumination, this swelling is brilliantly transilluminant. And other less common sites are cheek, axilla, groin, mediastinum. These are the less frequent site. So most common site is neck. So what is the behavior? Mostly this swelling is remain in the neck of the same size mostly, but sometimes the behavior may be unpredictable. How it may be unpredictable? It may rapidly expand in size, so much of big size that it may cause respiratory difficulty to the child. For that, sometimes we need immediate aspiration, or sometimes tracheostomy may be required. Occasionally it may get infected, and in that conditions we may need to drain the abscess. Now, what is the definitive treatment of cystic hygroma? Cystic hygroma is cystic swelling, so we need to do complete excision at an early stage. So simple excision is sufficient for this swelling. Sometimes we give the injection sclerosant, picibanil OK432, sometimes polidocanol, sodium tetradecyl sulfate. We just with the help of a syringe needle place into the cyst, and we inject this. First we aspirate and then we inject the sclerosant. So after sclerosant, there is a sclerosis and swelling is decreased in size. But what is the important thing? Sometimes swelling is multicystic. Mostly commonly it is multicystic. Then it is not possible that every individual cyst we may give the sclerosant. So that is the negative point. And one is the sometimes if we inject the fluid extracystically, then due to the sclerosis it may be difficult in the next further surgery may be difficult. So simple excision is the treatment of choice for the cystic hygroma. So this is a benign swelling, congenital, present in the neck of the neonate and infancy, and simple excision is the treatment of choice. Thank you.